hardworking canine heroes in the Kruger National Park being treated to top-notch dentistry. It's an important problem to try and deal with as well. The Cape Animal Dentistry Service and Hills Pet Nutrition joining forces to look after the dogs who help fight poaching. That's why it's so very important. We've been seeing reports that the poaching numbers are coming down a little bit, and these little canine friends are very important in that fight in anti-poaching. Dr. Guy Fyvie, Veterinary Affairs Manager at Hills Pet Nutrition, joining us this morning. Dr. Fyvie, good morning to you. I appreciate your time. Why get involved in this? What's the reason for you getting involved?
I think the reason for us to get involved is to be part of sustainability. If we can keep the dogs on the ground looking after the animals, then obviously we sustaining a natural heritage that we have.
So what's the solution that you're trying to provide here? So, because obviously the anti-poaching dogs, these are not your run-of-the-mill pets that you and I can go and hang around with. They're very, very highly bred. They're highly trained as well. They've got to be in tip-top shape, don't they?
Correct. And you know, very specifically, they use their scent. That's their job, is to follow tracks and to be able to smell and sense where the poachers have gone. So if we have a clean mouth, if we have a dirty mouth, then they're unlikely to be able to smell as well as to scent as well as they should be. So yes, if we clean the teeth, we're more likely for them to be able to not have inflammation in the mouth and in the nose, and they're able to then scent better.
So how does this dental initiative actually work at the Kruger National Park itself? Because I'm seeing that there's anesthetic monitoring, there's nursing, there's logistics. Just give me the rundown of just how big this is. I don't think people quite get a grasp and a sense of just what's involved here.
Yeah, so it's a whole team that's involved, 2 specialist dentists, anaesthetists, and we obviously have to have all the machines taken to the Kruger National Park, so a full dental suite to be able to do all the procedures that we need, and yeah, it's about 450,000 rands worth of services that we provided for, and I think that's it's a two week process, getting all the equipment there, setting it up, and then basically in an area where there's really not a lot of place to do the work, we do it in a bungalow, but it's still the same really good quality dental work that we should be doing.
Yeah, and because it makes a huge difference to those handlers and the dogs out in the field as well, trying to keep our wildlife safe out in the Kruger National Park, especially the greater Kruger National Park. To the latest memory that I have, I remember it being upwards of 50 dogs that were in active duty in that part of the Kruger Park. Can you give me a sense, Doctor, how many canines were treated? But also, it's not just German Shepherds we're talking about. I can't remember all the names of the dogs, but I do know there were bloodhounds involved at one point for different reasons.
Correct. Yeah, so the most common dogs are Malinois and bloodhound crosses. So it's a bloodhound and Doberman cross, which gives the dog a bit more oomph. The bloodhounds tend to overheat a little bit, so it's a very small amount of Doberman that comes in there. There are, yes, we did 53 dogs this time. We did the dental work on 53 dogs. There are a lot more dogs than that in the greater Kruger National Park, and we basically got those dogs all the way from the north down to the south for where we had to go, and that sort of around 500, 600 k's. But it's so important that we do that work that they were pulled out of service for a day or two just to be able to have their teeth done.
Yeah, absolutely. It's always about the prevention rather than the cure. And that's, I suppose, where I go to next, Dr. Fyvie, as well, is now this has been done for now. What is sort of the maintenance of this? Because it's all good and well to do this, but you can't then ignore it for the next 5, 6 years. You're going to have another problem, aren't you? So how often do you start going back and dealing with this, apart from dealing with their nutrition?
Yeah, so we do it yearly, and they should really be having a checkup every year, like we do. And so we try and get as many of them back again. especially if we've done some specific work on them before, like a filling to make sure that that it's still there and it's still working.
And just as I start saying goodbye to you, Doctor, anything to do with wildlife, anti-poaching, a lot of the time, this is often people, I imagine the same case for you and the other specialists involved in this, are giving up your time. These are volunteers, highly trained experts and specialists giving up their free time. How do members of the public get involved or support in any way? Is there a space for that? Do you have a call for anyone watching to provide anything, do something, just their time, money, etc.?
Guys, they can go onto makingcontact.co.za and they get all the information. There'll be all the information there, and they can also then donate from that point from makingcontact.co.za.
And we're going to say thank you very much indeed then for the moment, Dr. Guy Fyvie from Hills Pet Nutrition. It's not just about talking about the pet nutrition as well. It's so very important to keep these canines, all of them that are part of the anti-poaching units up in the greater Kruger National Park, in tip-top shape as well. And often that has got to do with dentistry as well, especially when the olfactory glands in the nose can be affected if their teeth aren't up to scratch as well. So you've got the details there. If you are interested in wildlife and helping in the anti-poaching sector as well, you've got the website there from the good doctor.